Hello, everyone. Welcome back. This is HeartBrief. I'm Joel Kahn, medical doctor, triple board certified cardiologist, preventive cardiologist, and clinician about to begin my office day in the white coat. So let's talk about some new research that's provocative and may improve both your knowledge and maybe allow you to practice patient care in even a more advanced way than you're doing now. Let's go to the first article. It is a basic science article, but it's so provocative. It's in preprint. It is fully available to read in a very fine journal called Nature Communications, just accepted in February, and the authors are apparent on the screen. And you will see that it is reporting that there is a connection using GLP-1 agonists and cardiac protection that raises the question of whether this is going to be in the future a treatment associated with acute myocardial infarction, a coronary syndrome, acute coronary syndrome, and such. And the point they make is even with emergency reperfusion, emergency angioplasty, and stenting, as they state in the first sentence, up to 50% of patients with an open artery after an emergency procedure still have poor flow. The microvasculature is affected, and they may end up with an area of akinesis, hypokinesis, lower ejection fraction, and the whole cascade of congestive heart failure and arrhythmia. This so-called no reflow or poor reflow is something I've seen in the cath lab over and over. So they looked at, in an animal model, infarct sizing with or without glucagon-like peptide 1, GLP-1, added on to reperfusion of these animals. They also looked at a pathway by which GLP-1 may be effective in improving coronary blood flow at the capillary level. And they indeed did find that GLP-1 release from the gut could be evoked, it could be abolished, it depends how you manipulate it, but that a brain-gut-heart pathway, which is cardioprotective and suggests that pharmacologic therapies may have a role, is something that will have to proceed to clinical trials. So we may be a few years away from a nice 500 or 1,000 patient randomized study of emergency revascularization and combination GLP-1 therapy. We're often using GLP-1 agents now after myocardial infarction, particularly in a type 2 diabetic or an obese patient. We already have the SELECT trial, but this acute use, very provocative, and I hope will be very successful, but we'll have to do the trials. Certainly not a reason to avoid using GLP-1 agents and the rest. All right, let's go to a second article that is more immediately available to help us and help our children. And that is an article in the International Journal of Cardiology, just published in the last week or two, available online in 2026. Childhood oral health is associated with the incidence of atherosclerotic cardiovascular disease in adulthood. Oh my God. Denmark, England is the location of the authors, those two countries. And what they did is in a Danish cohort study, amazing size, 569,000 individuals born between 1963 and 1972. I'm older than that, but whatever. They were in a registry. They had records, including their dental records, for the number of cavities, gingivitis, the degree of oral health or oral disease, and over time, of course, the development of coronary disease as these young children developed and became adults. What they found was, to quote, severe childhood dental caries was associated with increased incidence of atherosclerotic cardiovascular disease in both males by about 32% and females by 45% increased risk. High gingivitis scores also predicted elevated atherosclerotic cardiovascular disease risk. So not just severe caries, but gingivitis too. Moderate to severe level oral disease and oral health deterioration were significantly associated with higher atherosclerotic cardiovascular disease risk. So another study connecting the mouth and the heart, or you could say the mouth is part of the gut, so it connects the gut and the heart. And it's certainly a call to action, and it's a social welfare issue too, about access to dental care, access to quality foods, avoidance of sugary drinks, things that might provoke cavities and gingivitis in children, and we got to get them screened for and watch carefully. And let's do the one last paper here at HeartBrief. And we're going to go over right now. It's a British Medical Journal, Open Diabetes Research and Care, Association of Weekday Sleep Duration and Estimated Glucose Disposal Rate, the role of weekend catch-up sleep. Provocative title. They lay out that sleep duration is already an established factor linked to insulin resistance and metabolic health, with glucose disposal rate being a marker of insulin resistance. So they looked in this study at the famous NHANES study from 2009 to 2023. It's a database. This is not a randomized study. There were 23,000 participants. They had data looking at sleep duration. They had data on weekend sleep and the rest. They found that increased sleep improved estimates of glucose distribution or insulin sensitivity. While poor and short sleep, that was less than 7.32 hours at night, was associated with poor glucose distribution and increased insulin resistance. They also found that weekend catch-up sleep negatively moderated the relationship. So you didn't benefit, sadly, from the weekend catch-up sleep, according to this analysis. It's a U-shaped curve, and the ideal, I believe there was a graph that showed it nicely right about there, but you can see that about 7.5 hours sleep on figure 1 was the peak for glucose distribution, insulin sensitivity as a marker in this large sample, and less sleep and significantly more sleep did not enhance insulin sensitivity. In fact, seemed to be associated with it being knocked down. So we should be talking to our patients about sleep pathology. We should be exploring roles of enhancing their sleep, dark room, cold room, eye mass, white noise, maybe magnesium, melatonin, evaluating how late in the day they're eating, drinking, and consuming caffeine, and on, looking for sleep apnea with home sleep studies. But the importance of sleep and insulin sensitivity is made again in this interesting study. So we find a lot of sleep pathology at my preventive clinic, and I hope you look for it, find it, and help people correct it too. So thank you for joining me for this episode of HeartBrief. 3 interesting articles, 1 more basic science, and 2 quite practical in their implications. And I hope you have a wonderful week ahead.